Utilizing the Admission Navigator auto-populates the Adult Inpatient Plan of Care care plan. This care plan addresses fall risk, skin injury, VTE prevention, and infection. Add in the patient's primary diagnosis care plan utilizing the S20 templates. Next, to address the patient's comorbidities, add in the Comorbidity Management Care Plan. You'll see that this includes options addressing asthma, behavioral health, COPD, diabetes, heart failure, hypertension, and sleep apnea. Select all that apply for the patient and accept. Add expected end dates for each patient goal. These may correspond to the patient's discharge date. For patient goals, we start in the Plan of Care Review tab, addressing interdisciplinary goals for PT and OT, dietitian, and RT. Then we move to the Patient-Specific Goal or Individualized tab, where we document patient-focused individualized goals and address pain management. At the end of the shift, it is the expectation that each nurse will document under Plan of Care Review. Were their goals met this shift, not met this shift, or were those goals completed? Who was the Plan of Care reviewed with? The patient, the family, or other caregivers? And what was the patient's overall progress? Are they improving? Was there no change, or are they declining? Under each section, there are also options for additional documentation by selecting the Interventions tab on the care plan. These options correspond to flowsheet rows. To promote interdisciplinary communication and continuity of care, it is the expectation that each nurse write an end-of-shift narrative note summarizing the events of the shift. There are templates available by searching Care Plan Shift Note under the Smart Text lookup. After completing the narrative portion of your note, add in the problems that were addressed during the shift and sign your progress note. By following the steps we discussed, your final progress note will contain individualized care plans addressing the patient's primary diagnosis and comorbidities with time-limited goals. It will clearly identify to the interdisciplinary team the patient's progress towards discharge.